Hey, I'm David Carver, and I'm doing my project on medial collateral ligament injuries, or MCL injuries. So first, we'll go into a little bit about what an MCL is. It's one of the four ligaments that stabilize the knee, and it's on the medial side. This is where the MCL is. Then there's also the lateral collateral ligament that's on this side, and then the anterior and posterior ligaments, which are actually within the knee. And so what the MCL does specifically is it keeps the knee from going too medial. So like how my knee's not able to go all the way in, that's because of my MCL. And that's actually how you injure it, is you'll get a lot of blows to this outside knee, and if it goes too far in, it can stretch it, it can sprain it, or it can tear it. So then there's three different types of MCL injuries. The first one is a grade 1 injury, and it's a minor knee sprain. It's going to have some minor knee pain with it, or maybe a little bit of swelling, but it's not going to be completely structurally injured, really. There may be a little bit of instability while you're walking, and it might feel kind of weird to walk, but when a doctor tests it, it'll feel structurally sound. So then there's a grade 2, which is either a severe sprain or a partial tear, and that comes with a ton of pain, severe tenderness, and a lot of swelling. It's also very unstable compared to a grade 1. And when the doctor tests the grade 2, if it's a grade 2 tear or sprain, he'll feel the instability within the knee. And then there's a grade 3, which is just a complete tear. It varies in pain. Sometimes it can have a lot of pain, sometimes it won't have much. And many times a grade 2 will bring more pain than a grade 3. But there's going to be a lot more swelling, there's going to be a lot more restricted movement, and the knee joint is going to be a lot more unstable. And then when it's that type of blow, when it's a blow big enough to completely tear the MCL, there's usually going to be some other things. So some common ones are an ACL tear is common with an MCL tear, and a meniscus tear is common with an MCL tear. And many times that will result in surgery. So then the recovery phases for these MCL injuries kind of vary on how long and how much work it goes into them, depending on your age, your gender, how bad it is, and just the individual person. And so, but there's 4 phases, and phase 1 is usually about 1 to 2 weeks, and that's when you want to ice and rest and really get some of that swelling down. You're going to ice about 15 minutes every 2 hours, and you're going to rest. You don't want to put a lot of impact on it. The main goals of this phase 1 is to decrease the swelling and increase the knee flexion up to 90 degrees. So you want to be able to get that up to about right there in that 90 degrees. And so then a phase 2 lasts about 1 week, and that's when you want to start increasing the activity. You're going to have a knee brace on while you're walking, and you want to use that same brace when you work out at this point. And you're going to start getting some work in on the stationary bike, which will strengthen the muscles and increase the mobility and work on the knee without risking any more damage to the ligaments, because it stabilizes the knee for you. And so then you also want to add in a little bit of pain-free stretches. If it hurts at all, you don't want to do it, but maybe just a little bit of stretching, a little bit of pain-free stretching. And so the main goals of phase 2 is to get up to 20 minutes on that stationary bike. If you can get up to 20 minutes by the end of that phase, then you're doing pretty good. So then we go into phase 3, which really is when you start increasing and turning the pace up on everything. It lasts about a week. And before you get to the end, either before this phase or after this phase, is when you're going to get a checkup and kind of get it tested and see what the doctor thinks about the recovery. And so you're going to increase the amount of time and the resistance on the stationary bike in phase 3. And you want to also increase the balance. And then, so then the main goals of this phase 3 is to get out of the brace. By the end of it, you shouldn't have to wear the brace. You'll wear a knee sleeve type of thing, just a little athletic knee sleeve when you're working out, but when you're walking and doing everyday activities, you shouldn't have to wear a brace. And then the full range of motion is restored, and you should be able to move that knee as much as you can move the other knee, at least close, by the end of phase 3. And so then that goes into phase 4. And phase 4 is such a broad one. It's about 6 weeks from the injuries when you're about to start phase 4, but it goes until you're completely recovered. And so what you do in phase 4 is you're going to start kind of trying to get back into normal activities. You want to be able, you should start running, maybe not fast, maybe not full speed, but you should start doing a little bit of running with your sleeve on, and also without any sudden range of movement. You don't want to be doing little cuts and change of motion type of things. You want to kind of stay stable and still protect that knee. And then the other thing is you're going to move from double leg exercises like the bike when you're working on both knees, and it's not just your right leg, working out to single leg exercises and really do some things to help that knee strengthen back up. And so then some of the goals with this one, there's long-term and short-term goals because of how broad it is and how long the phase can last. Some of the short-term goals are to be able to get up to full speed running and work up to that, and be able to add some small change of pace or a small change of direction with the help of your knee sleeve. And then some of the long-term goals are to be completely out of the brace, don't have to wear the sleeve either, and to be able to pass a fitness test without problems. And so then a couple of the things that we can prevent MCL injuries are strengthening the muscles around the knee. Warming up and cooling down is important. Stretching. You can tape your knee and tape the ligaments around the knee to help provide some more structural support for the knee. Proper footwear can play a role in it. And working on your balance. Those are some ways to prevent the knee injury. And thank you very much. I hope this helped, and thank you.